Hi, everyone. Welcome to Ask the Experts, science-based child anxiety strategies that work. I'm Markina. I'm a book marketer, and I've known Dr. Bridget Walker for a long time, back when her book was first released, Anxiety Relief for Kids, the first edition. And now we're doing this today because her book has an entirely new, completely revised update. I'd like to introduce first Dr. Bridget Walker. Please say a little bit about yourself, and then we'll go to Dr. Eli Lebowitz.
Hi there, I'm Bridget Walker, and I'm a clinical psychologist, and I have expertise in cognitive behavioral therapy. And in particular, I use CBT to assess and treat children and people of other ages with anxiety problems. Um, I've decided to focus on kids a long time ago because CBT is super effective, as is Ellie's work. And I feel like if you can intervene at an early age, you can really help people thrive. And so that's why I did it. I found Ellie's work at a plenary session probably 11 years ago at an OCD conference. And I was like, wow, that stuff really makes sense. So I started using his work and have been ever since. So I think that's me.
Well, thank you. That was very kind. I'm Eli Lebowitz. I'm a psychologist. I'm a professor at the Yale Child Study Center, where I co-direct our anxiety and mood disorders program. My work tends to focus heavily on parents and parent-based approaches to helping kids with anxiety, OCD, and other related conditions. And I'm a big fan of Bridget. If you don't have her book, go get it because because if you are, whether as a parent or as a therapist, if you are concerned about anxiety in children, I think Bridget, I hope it's okay I say Bridget, maybe I should say Dr.
Oh, no,
Walker.
no, no, no. Please, 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 please.
I think she has a real knack for just taking real rigorous science and scientifically evidence-based approaches, but translating them and distilling them into something that is just so practical that anybody can just pick up and immediately make use of. So I think it's one for really any bookshelf. And I'm happy to be here and be able to have this conversation together. So thanks for including me in this.
Yeah, super.
And the first question we were going to talk about is kind of general. So, what is the first step to take when you think your child might be dealing with anxiety?
So how about if I start?
Mhm.
So I think it's important to educate yourself about how anxiety works, how it's maintained, and how it starts, how to recognize it in kids, because it can often be, it's not obvious. And so a book like mine, a book like Ellie's, um, because a lot of what we do is counterintuitive. The way you conquer kids' anxiety problems is very counterintuitive. And it's funny, a colleague of mine says you can't parent an anxious child intuitively. So one of the things that's important to understand is that kids with these kinds of issues, they tend to notice things that are they tend to find danger in many situations that really where there is no danger. And in fact, that's the definition of an anxiety problem, is to have fear when there really is no danger. And so kids experience a high level of distress, right? And nobody likes that. And the levels of distress are quite dramatic, as you may have noticed. And then kids resort, and parents alike, to behaviors that reduce their anxiety or prevent their anxiety. And we call these safety and avoidance behaviors. And if a kid has OCD, we call them rituals. The problem is those behaviors work in the short run, but because they work, they become habit forming. You know, our brain perceives a relief in anxiety as a reward. So it's like kids really develop strong habits. And the problem with engaging in those behaviors is they prevent a kid from learning something different in that situation. Like, I can handle it. Like what I predicted would happen doesn't happen. And so I always start every consultation with that, because if you don't understand the mechanisms and the science behind it, it's hard to understand the treatment approach. So educate yourselves.
I love that. I think educate yourself is good advice in so many in so many areas, and definitely here as well. I would add slash don't panic. I think anxiety is so common. We all deal with anxiety at some level, but some people, kids and adults, deal with it more, and that's really common too. But it's not like the worst thing in the world. It is a really treatable condition. So I would say don't panic and maybe don't jump right away to like you said, it's hard to be intuitive, and sometimes you jump right away to either really pushing the child to like you have to cope with this because you're so worried. You're so worried that this might really be a blight on their life, that it might really impair them. And so you're trying to push them really hard. Or the opposite, you're trying to protect them so much and you jump into that really protective mode of how am I going to make you feel okay all the time so that you don't have to deal with this, you poor thing. And both of those things, while really well-intentioned and loving, they're ultimately not that helpful. So I would say have a more curious and open and non-judgmental attitude first. Maybe ask your child, maybe if you're not that panicked, they'll be able to talk to you about it a little bit, explain to you a little bit. And if you're feeling uncertain, maybe get an evaluation. Talk to your pediatrician, talk to a psychologist, talk to a social worker, somebody who knows about anxiety and can start to guide the process of how are we going to work on this? How are we going to get over this? But take a deep breath first.
That sounds great. I wanted to ask you, Ellie, a question because our work is different yet complementary. How did you become interested in working at it from a family and parental approach?
Yeah, I've been doing this for for a long time, but and increasingly, I guess it feels more accepted and kind of like a go-to kind of strategy to work with parents. But when I started doing this work, that was not the case. And I was quite frustrated by that because there are other domains of mental health problems where we've known for a long time that working with parents is sort of like a thing to do. If a child had behavior problems, oppositionality, they're acting out, they're misbehaving, things like that, then decades and decades of work showed that working with parents can be effective. But when it came to what we, like psychologists, tend to call internalizing problems, anxiety, depression, the more kind of inward difficulties, that really wasn't the case. And I think people thought about it a lot like a dental cavity, meaning this is a problem that lives in the child's head. And if you have a child with a dental cavity, you probably need to take them to the dentist if you want them to overcome it. And like, there's not much that you can do without getting them in that dentist chair. But I was really frustrated by that because there are a lot of kids who really aren't the ideal candidate for doing therapy themselves. CBT, like you said, it's incredibly effective when you do it. And it's not at all effective when you don't do it. And dragging your child to a therapist when they don't want to go is an exercise in frustration for both child and parent, and frankly, therapist, and doesn't tend to be all that effective. And so it just seemed like, such a glaring gap that we have so much to offer parents of kids with other problems, and yet when it came to anxiety, we really don't. And I also was just really focused a lot on these family systems. And I just, it was so clear how much parents really are involved in their children's symptoms. Because if you're a child, the most natural thing in the world is when you're anxious, you look to your parent. And your parent steps in and they want to help you feel better and they want to protect you and they want to reassure you, or they want to like do that kind of coachy, pushy thing. But either way, they're really very involved. So it seemed like a lot of opportunity as well as like a lot of untapped potential to work with parents. And that really was a big impetus for me to say like, okay, but what can we do that would be effective? And that led to the development of an entire treatment approach that works entirely through parents and doesn't actually require the child to go to therapy sessions at all. That's called SPACE for people who want to Google it. That is SPACE, or supportive parenting for anxious childhood emotions.
Great.
And then what are some good ways to respond when a child's anxiety results in verbal aggression towards the parent? That was one of the questions posed. We're at
Uh,
number 4 on the list.
Yeah.
you want to
Uh,
go ahead?
I, I would say, first of all, I think the most important thing is to recognize that you're still dealing with anxiety. Maybe it looks now more like anger, aggression, some bad language, disrespect, and it starts to feel like this is more of a disciplinary issue. And that tends to bring out in parents the more harsh, kind of maybe a little punitive, or even if it's in a kind way, you sort of want to teach them proper respect and boundaries, and that becomes the focus. But what's lost in that is that you're actually still talking about anxiety, not about behavior problems. I like to remind parents that, I think we all know that phrase, fight or flight. Everybody's heard that. I don't, I'm sure everybody on this call has heard fight or flight. And I think a lot of times we tend to forget that half of that is fight. And what that means is that anxiety primes us and readies us for avoidance through feelings of fear, but it equally primes us and prepares us for aggression through feelings of anger, irritability, sometimes rage, because that's another way to deal with threats is to confront them. And so, first of all, take a breath and remind yourself that you're still dealing with anxiety. And a lot of times, I think the best way to respond is not to respond. Not everything needs to become a focus or an issue. Sometimes, your child was in a really anxious state and they yelled at you or they said something rude. Not everything has to be something you jump at. Maybe the best thing to do is just say, I see you're having a really hard time. Let's take a break and give them some time and talk about it when they're calmer. If you had a child who was terrified of needles, just like terrified of shots and needles, I've seen lots of kids where it takes like 3 adults to hold that child down so that they can get their vaccine, get their shot. And sometimes that child is just in a panic, lashing out, and they may even hit somebody. Maybe they hit the nurse. But if you're smart, you don't look at that child and say, oh my gosh, what a horrible kid who goes around beating up nurses, right? Because that's not the case. That's the wrong interpretation. This child didn't wake up today and say, who should I beat up today? I haven't done a nurse in a while. Let's go hit a nurse. They're terrified and they're lashing out. And so a better way to respond is probably just calm yourself and be understanding. And I'm not saying it's okay for your child to yell at you or your child to hit nurses, but it's also, I think, the wrong story to tell about this event that this kid is like misbehaving. And so a lot of times I think you really are best off maybe not addressing it at all and just understanding that this is one more expression of anxiety.
Mhm, mhm. Yeah, I mean, I see a lot of emotional dysregulation, and in fact, a lot of people will focus just on that rather than the root cause. And when a kid is super anxious, they will do just about anything to not be in that situation. And it isn't always obvious. I mean, they will make threats, they will get physically violent. And in my work, I sort of figure out the patterns, right? What are the situations that trigger a kid? And we flesh them out and we name those behaviors. And then we practice being in those situations and doing other behaviors. A tactic that I teach parents, I call safe ignoring, which is basically what Ellie's saying, is just say, John, um, that sounds like worry bug. So I use nicknames also to help kids objectify it. That sounds like worry bug. I'm looking over my shoulder, I'm going to do safe ignoring now. So a kid knows what you're doing, doesn't feel like you're being mean and ignoring them. And I practice that with kids in my office all the time. I ask them to kind of do what they would normally do, and they kind of have a good time with it, and get really mad and yell and scream or whine or whatever it is. And then the parents practice, and it can be really hard for parents. So that I find it really useful to practice. And sometimes when I do practice, we'll make little adjustments. Like it's hard for parents to set those limits sometimes because they want to help. So I might say, well, you can still give them a hug, and be warm. And it's all about accepting what they're going through and helping them. So I deal with that quite a lot, and it's just kind of happens with these kids, and it's good to understand that it is, like Ellie said, anxiety.
I love that. I love the idea of practicing, simulating it, sort of role playing it, practicing it in the office, because yeah, it might be hard, but it's going to be a lot easier than when it happens at home, which A means it gives you a little bit of practice. But
Yeah,
also, if you think about it, the behavior is the same. What you're practicing, what's happening at home, the behavior is kind of the same. If it's easier for you in the office, that means that what's different is your state. It's your emotional reaction. It's your interpretation that is making it harder at home. And so maybe just noticing that would also help you to carry over some of that more calm approach at home. Obviously, not everything can be ignored when a child is truly physically violent in a significant way, or when they are destroying your property. Not everything can be ignored. But you know what? A lot of it can. And a couple of months later, when your child is so much better and they're not that anxious anymore, you're not going to look back and say, well, my kid's not anxious anymore, but who cares because 2 months ago they yelled at me. No, you're just going to look back and say, that was a really hard moment that they had to go through, that we all had to go through on the way to getting better, but you're going to have that perspective. So,
right.
try to have that perspective earlier on. I hope you get through those moments.
Right, right. I agree. Sometimes it takes a lot of practice.
Yeah.
So, but I agree.
Yeah. Marquino, take us, what's
Okay,
next?
but then what will happen how do you help a child when they have physical manifestations such as dizzy spells or blurred vision?
Hmm.
So, it's very common for kids and adults alike to become fearful of the physiological sensations that accompany anxiety, like a racing heart, lightheadedness, dizziness, sometimes nausea. In fact, a lot of kids become fearful of vomiting. Emetophobia is a really common thing that I deal with, which can be really problematic. But it's first of all it's important to understand what it is. That this is your body's way of, in a sense, protecting you, but it's happening at a time when it's not really appropriate or it's exaggerated, and that you're not in danger. But what I do, most of what I do is exposure based. So when I have a kid who becomes afraid of these sensations, I will practice in various ways appropriate for the kid, to bring on the sensations a little so they can learn from experience that they can tolerate them and learn that perhaps what they're most afraid might happen doesn't happen. Like I've had people tell me they think they're going to die, and I will, have them bring on the sensations in small ways. And after they do it, I'll be like, "Did you die?" And they're like, "No, I'm still here." So I mean, literally, it's in vivo. Let's do it. Let's learn, and it really helps if I'm there. I mean, I'm sure, because they feel safe, because they know that I'm not going to let something bad happen, and they can practice it. And then I give that to them for homework assignments, so they practice more. Because when you do exposure work, it takes a lot of you have to do it en masse for it to really make a difference. So anyway,
Yeah, I think that's
that's
terrific advice. And you know, maybe like the most important message I would want the parent to hear and also the child is that this is safe,
yeah,
right? Like it can be dramatic and it can be uncomfortable, but actually it is no danger at all.
yeah,
Your child is not at physical risk because they have even a pretty dramatic physical anxious response. I would say to any parent, if your kid can run a quick sprint and still be safe and alive after, then they can have a full-blown panic attack and still be safe and alive after. Because honestly, your body is doing really similar things in both of those situations. In both of them, you'll be out of breath. In both of them, your heart's racing, you're sweaty, maybe a little dizzy, maybe a little nauseous. But the only real difference here is when you run, you know why all that's happening. So it's not really scary. When it happens because of anxiety or when it's triggered out of the blue or you're in response to some scary thing, then it feels out of control and it feels dangerous, but it's actually not dangerous. So I'm not going to recommend panic attacks to, octogenarians with bad hearts.
right.
But if your kid is reasonably healthy, they can have all the anxiety response they want. I'm not wishing it on them, but it's just uncomfortable. It is not a danger.
Right. I might just add that, when it is safe, but one risk is that a parent might fall into reassuring a kid. Okay, Johnny, don't worry, this has happened before, you're safe. And that tends to backfire. And wouldn't you consider that an accommodation behavior, Ellie?
I would consider it an
Yeah.
accommodation, and it plays into actually what is the only real risk of having anxious reactions. And that's not the physical experience itself. It is starting to shape your life
Yes.
around trying not to have it.
Right.
You could have, a panic attack every week and be totally fine as long as you are willing to go through that. But you could have two panic attacks in your whole life, but live years of your life in a really limited and a really impaired way because you're so scared of it happening again. And in fact, in all of the anxiety problems, the real problem is that you're so unwilling to be anxious.
So for the next one question, it was something that many of the parents on this call had that it's how do you support students with school-related anxiety? And that's including math anxiety, social anxiety, and especially perfectionistic kids who understand their anxiety intellectually but still fall apart in the moment. And that anxiety might also be exacerbated by high-achieving parents. So this is kind of a lot. I'm not sure who wants to take this on first, but
Maybe I'll start if that's okay.
Sure, yeah, perfect.
Um, yeah, in the second edition of my book, I added a lot more on perfectionism because I see it a lot in my practice with little kids, even really little kids. I mean, I've had sixth graders who have home offices and are afraid that if they don't go to Harvard, their lives are going to be useless. And obviously, there's if a kid has their home office, that's a parent is kind of aiding and abetting that. But perfectionism is not super well understood by lay people. What it really involves is fears of making mistakes, missing things, not meeting self-imposed standards, which by definition, I think are unrealistically high. And these kids and adults alike, they feel like they're terrible. They feel worthless. It's a very negative. I mean, all anxiety issues are negative, but it really is demoralizing and affects people's sense of self-confidence and self-efficacy. And I deal with this a lot. And it also, kids will procrastinate doing their work because the process is so anxiety inducing. And so often it takes forever. So they'll procrastinate, which kind of seems counterintuitive in terms of perfectionism, because most people, lay people would think, well, you do the homework right away, which you see also. I've seen kids doing their homework on the bus because they're afraid they won't have enough time. And so it is very individualized. But I'm just thinking of a little kid that I worked with who I think was about 7, and he had a lot of anxiety about math, super, super smart kid. And he would look at a problem and freak out. He wouldn't even read it. So we practiced, look at the problem, just look at it. Pick the problem, pick how you're going to solve it, give it a go, means try. Because you don't know how it's going to end up until after, and see how it goes. Because the perfectionistic kids and adults alike, they want to be certain that it's going to be okay. And you can't be certain. It's sort of like sport. If you're an athlete and you focus on the end result and you think, well, I have to make this time, or, my life is over, or I'm going to let down my whole team, you're going to choke. So you have to kind of be present. And there's a lot of things that I do with kids. But things like that, let's follow these steps, pick a problem, do it in order, decide how you're going to approach it, give it a go, see what happens. See what happens. You cannot predict what the outcome is going to be.
Yeah, great advice. I guess a couple of things that I would one is if your child is struggling with specific content domains, like with math, with reading, with one thing that I would say is, have you actually checked whether they do have a genuine difficulty in that area? Because some kids do, and it's not always readily detected. It's not always obvious, even to teachers or schools. A lot of learning differences go undetected for a long time. And of course, if you struggle as a child with math, well, you're going to get pretty anxious about it. It's going to be a really stressful thing for you because people expect you to be able to do this and all your friends can do it and you're getting bad grades and people think you don't care and they treat it as low motivation. But a lot of times there's just a genuine difficulty that needs to be addressed. And finding that out, if you haven't checked or you don't know, consult, talk to the school, the teachers, the social worker, and get a referral, do an evaluation like a neuropsychological association. Because if you do find that they have a learning difference, hey, they'll be eligible to get supports that they require, and the learning can then be adapted for them in a way that will often help them to catch up with the other students. So one thing I would say is, first of all, rule out whether there is a genuine learning difference, because sometimes there is. Not every child who's anxious about school has that, but some do, and I think it's not like wise to just skip that or discount it. You were talking about like just try. I think that's like, yeah, be ready to like be okay with a certain amount of failure or a certain amount of mistakes. Sometimes like practice purposely making a mistake, just like any other exposure that you would do. How
Right.
about we hand this in with two deliberate mistakes and see that the world doesn't end and, like the sun still rises tomorrow, etc. Sometimes it's helpful to break things down into smaller steps. One thing that happens when you're really anxious is you focus on the really big picture. You think, I have this assignment, I have this homework, I have this test, and that feels like a really big thing. And so you get really overwhelmed by it, and then you avoid it. You procrastinate, just like you said, and then time is short, and then you're out of time. And now it's even more stressful, and now it's like a huge problem. But sometimes it's easier to just think, what is the next one specific, concrete, doable thing that's like 10 minutes that I can do, and then I'm going to take a break. Even if I'm not done, I'm going to do this one specific thing for 10 minutes. Because doing that has its own reward, right? Now I feel like, hey, I did do something. And I get a little break, and then I'm motivated to do like a little bit more, one more step. So breaking things down is often useful. Two other quick points is one, communicate with the school. You're sending your kid to the school where all of these expectations and evaluations, they're all happening, but talk to that environment. How is the school broaching this? What do they understand? What do they see? How are they addressing it with the child? Be communicative, be collaborative. In my experience, when I talk to teachers, so often what they say is, oh, these parents, you can't talk to them. They don't want to communicate. They don't want to work with us. They don't want to collaborate. But when I talk to parents, what they say is the mirror image, which is the school. I can't talk to them. There's no one to talk to. They don't want to collaborate. And so I think there is goodwill and good intention on both sides in most cases. And it just takes sitting down together in a respectful way, not in an adversarial way, but just talking together about what can we do to make this a little bit better for this child. And last thing I promise is think not just about what are you saying to your child, but also what are you showing your child. Children learn all the time from their parents. They learn all the time, not only in the teachable moments where you think you're teaching a lesson, right? Like we all have these like lovely sort of daytime TV moments where it's like, oh, son, let me explain when I was your age, blah, 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 and I'm teaching you something about life. But kids are learning all the time. I have um, like three kids and like they're teenagers, but learning to drive recently. One got his license, the other's learning to drive now. And when your kid is learning to drive, I think it's a good example of what I mean, because you realize, sure, there's the time when he's driving and you're giving guidance, like here's how much distance to keep. But you know what? They're also looking at you when you're just driving, and they're learning from your behavior. So what are you modeling? You can say to your kid, you don't have to be perfect. But if you freak out when you're not perfect, then they're looking at that and they're learning that and they're applying that to themselves as well. If you can't be okay with a tiny stain on your on your clothing, or a mistake that you made, or a bad day at work, or what have you, if you can't talk about how you feel, then they're learning all of that and they're applying that to themselves as well. So I think, especially around perfectionism, think not just what are you saying to them about perfectionism, but what are you actually showing them about it.
Um, I agree. I just want to add one thing because Ellie, you have a book coming out on anxiety about schoolwork. What is it called? Breaking Free of
No, the school one is called Anxiety in the Classroom.
Okay. So I talk to many counselors, teachers, and one thing that I notice is that, I mean, they tend to be very well intentioned. They just don't know what to do. So often I will, and often these are kids who will come up to their teachers because they are doubting whether they understood the instructions or if they're doing it right. And they'll seek reassurance constantly. And it really helps teachers to understand that that's not going to help the kid. And maybe to say, Johnny, why don't you try, give it a go? Just give it a try and let's see how it goes, rather than jumping in all the time. Um, and also some schools have now like these calm down rooms, which is really problematic from my perspective because these kids then it teaches kids that anxiety is bad and something to be avoided rather than okay, you can deal with it, keep going. So often I will advise counselors, teachers to not have kids leave the classroom when they get distressed because that happens a lot too, and that is an immediate reinforcer of the kids' anxiety. So it's really important, and I'm glad that you wrote that book for teachers, counselors, um, to know this stuff because they see it all the time too. They're front facing.
Yeah,
Um,
I love that you said that. And in fact, we mentioned the title, which is Anxiety in the Classroom. And we
yeah.
actually chose that title. I say we because this is co-authored with another amazing person who's Dr. Rebecca Etkin. But we chose that title, Anxiety in the Classroom, because when we started writing this book, we kind of like went on Amazon and so, what are the books for teachers? And a lot of them have titles that are along the lines of, or in some cases, like actually the anxiety-free classroom. And the anxiety-free classroom is the wrong goal,
Yeah.
right? Just like the anxiety-free household or the anxiety-free
Right.
person, that's the wrong goal. In fact, that's a trap. That's a trap you fall into, and that's exactly what you're talking about. Because teachers do accommodate anxiety much in the same way that parents accommodate anxiety because they're trying to help a kid not be anxious, or they think we should create this stress-free environment, anxiety-free environment. But that is not an attainable goal. And in fact, it's problematic because it sends the message anxiety cannot be tolerated. We have to get rid of it, right? We have to do away with it. It's like treating anxiety the way you treat, other problems in school, like, I don't know, like
Polio.
violence, bullying, drugs, guns, right? Like those are things you don't want to allow in your school. Anxiety is not that. Anxiety is going to be in your school. So we decided to call it anxiety in the classroom because it's there. And now let's think about how we can deal with it better.
That's good. Now we have the inside scoop. Yeah, that's good.
There you go.
We had a parent who said that they have a teen who fixates on whatever she's anxious about in the moment, and breathing tools are not helping. What might you suggest to get her out of it?
Um, I'll start with that. I mean, again, I kind of go back to the first question. Educate yourself about what is effective in helping your kid with anxiety. Um, and in this question, it's unclear, what is triggering the anxiety, what the anxiety is about, because that's really important to be discussed. And in my book, I guide parents, how to ask these questions, how to have discussions that are supportive. And breathing, I'm sorry, is usually not going to be that effective. There are many other things that will be. So if your expectation is that breathing is going to solve an anxiety problem, I would say that would be really unrealistic. Not, and there's a lot more that can be done, but you have to understand the intricacies of what a kid is afraid of, what behaviors they rely upon, how hard it would be for them to not rely on those safety and avoidance behaviors. Um, that sounds like a kid who may have, generalized anxiety problems, like fixating on multiple things, which can be kind of exasperating because anxiety is very irrational and parents know it and they're like, well, what are you worried about that for? But that's the nature of the beast. Um,
Yeah, great advice. What would I add? First of all, yeah, it's true. Like breathing by itself, that's probably not going to treat an anxiety disorder, and you shouldn't expect it to. It can be a useful tool for lots of kids. It can be a useful tool, a way to regulate yourself, but you can't expect to learn a breathing exercise, know it in your head, never do it, and then pull it out in a moment of panic and think that it's going to work. This is not a sedative drug, right? Like you go to the pharmacy, they give you your Xanax, you keep it in your pocket. Disclaimer, this is no
don't do
pharmaceutical
that.
advice. However, but as a metaphor, I'm using this as a metaphor, and
I,
I'm saying, if you go to the pharmacy and they give you your like kind of really anxiolytic, anti-anxiety medication, you keep it in your pocket until you're like boarding the airplane because you're terrified of flying, and then you pull it out and you take it, you fall asleep, and you're fine. That is not how breathing exercises work. If you want to make use of it, you got to practice it. You have to practice it when you're not anxious. Do that for a few weeks. Get really good at it. Get much better at regulating your own internal state. And then maybe you'll be able to use it in a moment when you are more stressed. Don't just think you'll do it because you were taught it in a session a few weeks ago. The other thing I'll say is that sometimes breathing and even the suggestion around like relaxation is just really, really counter to what the child is feeling. Because here's another metaphor. Here's or an analogy or whatever. Like, just imagine you're a parent. Imagine that, and I hope I don't stress anybody out, but imagine your kid doesn't come home from school one day. And it's been several hours and you haven't heard from them, and you called their friends' parents and they didn't see them, and you tried their phone and their phone is dead and they're not answering, and you are freaking out, right? You are just panicking because where is this kid? And now imagine that I came up to you and I said, I want you to breathe really slow, in and out, take a deep breath. I think you'd punch me in the face, right?
right.
I think you'd like, you'd want to kick me because that is so counter to what your body and your brain are just screaming, and it just feels so off and misaligned. And sometimes when a child is really, really anxious right now and you come to them, you say, use your breathing, and they just want to punch you in the face because it doesn't feel right. And so not every moment is the moment for, that kind of breathing. By the way, there are other physical regulation tools that sometimes work a little bit better in those high tension moments. For example, actually, one way to relax your body is to go with the flow rather than try to swim against it, and actually clench your muscles, tighten up your body, squeeze your belly and your fists and your toes and your butt, and like make your whole body really tight and tense, and hold that for 30, 40 seconds, and then release it. And when you release it, it's a little bit like if you pull a rubber band in one direction, it tends to snap back in the other direction. Sometimes that will actually be an easier way for a really anxious child to relax, because you're not starting from the, relax and breathe, that feels so off. But I wanted to be, and I'll stop with this, but I wanted to actually pick up on the last phrase in that question, because I think it said, how do you get them out of it? Right? How do you get them out of it? And maybe that's actually not the right question to be asking. Maybe you don't need to get them out of it. Maybe that goes a little bit back to the idea that it is intolerable, that it's not okay. But actually, it is okay. It will pass. Maybe you don't need to get them out of it. Maybe you can just be there with them for a while. Maybe you can give them a hug and just say, like, I see you're having a really hard time, and I'll check on you in another few minutes, or something like that. I'm sorry, I love metaphors. And so I will say one more, but hopefully it's not too much. If your child was bleeding, imagine they're like, it's another ugly metaphor, but imagine they're bleeding like profusely, they're like bleeding out. In that moment, you would stay with your child at all costs, and you would do everything you can to stop that blood flow. Even if it wasn't working, you wouldn't say like, hey, I tried, now I'm going to go have my coffee while you bleed out. No, you're going to stay there, and you're going to put pressure, and you're going to do everything because you're frantically trying to stop something that is so intolerable. And when your child is anxious and you are there, just frantically trying to calm them, by the way, frantically calming people, not usually a recipe for success. But if you're there and you're like, I gotta get you out of this, then you are communicating the message. This is an emergency. You're bleeding out. This is so intolerable. But what you actually want them to start to feel, and not overnight, this takes time, but what you actually want them to start to feel is this is uncomfortable. Not this is bleeding out. Not this is so intolerable. It's just uncomfortable, and also it passes. So maybe don't make the question, how do I get them out of it? But, how do I support them while they feel that way?
Well, that underscores really the principles of exposures too, because if you allow that and don't try and fix it, then they have the opportunity to learn that it isn't that dangerous. And so the next time they feel their heart starting to beat faster, they aren't going to have the thought, oh my gosh, I'm going to feel panicky, which is happening in their brain, which is where the neurotransmitters are going to be secreted that's going to activate them more. They can start to learn, okay, I can handle this. And it's not even always at a conscious level. That's what I love about exposure work. It's all about learning all the time. And so, yeah, just letting it be gives them an opportunity to learn. It's an exposure. Anyway.
Excellent. Those are really good suggestions considering, I'm also a parent. I'm really learning a lot. Thank you. What do you suggest when parents agree to avoid accommodating their teen or child, but they keep accommodating them anyway?
This feels like a natural for me to
For
jump
you.
in on because I'm like the don't
Yes.
accommodate anxiety guy. But um, you know, I think that just deciding you're not going to accommodate is not really a viable strategy for most parents, which maybe sounds surprising coming from the don't accommodate anxiety guy. But really, that would be like saying don't avoid. Right? It's like if you went to therapy and they said, "Oh, you have anxiety. Well, don't avoid. Here, you're welcome. I did therapy on you." No, not really, right? Like that's not actually like a method that you're going to succeed at. You need to be a lot more systematic about it, right? I would say think about what are the accommodations that you do. So take stock about what are the accommodations that you do. Maybe pick one thing. Don't try to stop all your accommodations. I don't think you'll succeed. Just pick one thing. And even on that one thing, maybe don't even stop it completely. Maybe stop it partially, reduce it gradually, just even a little bit. And then there's a much higher chance that you'll be able to stick with that plan. I tried to lay all of this out in a really detailed way in a book for parents that's really focused on how do you support a child and work on those accommodations. It's called I hope I'm allowed to do this. It's called Breaking Free of Child Anxiety and OCD. But it's like a way to sort of walk yourself through doing this in a much more
I have
systematic
it
and
right here.
oh, there you go.
It's a
Thank you.
great book.
It's a much more systematic and methodical and compassionate approach than just saying, stop your accommodations. Sometimes even that is still really hard. Your child might respond in ways that are challenging, or maybe it feels a little off to you. Maybe you find it emotionally really challenging. And so I think like breaking it down like that and really preparing yourself and also communicating to your child what you're going to do differently makes it a lot more likely to succeed. Another thing that makes it more likely to succeed is if both parents, if there are two, are able to get a little bit on the same page about it. That's not always possible because we're human and sometimes we have disagreements. But to the extent that it is possible, even if you're not doing as much as you wanted, but you're doing it together, or you're doing a little bit different accommodation, but you're doing it together, that's probably better than just, sticking to what you think is the best thing, but going it um, but going it alone. And the truth is that it's actually okay if you don't stop all the accommodations at once. When we do actual therapy for real, like even serious anxiety disorders or OCD, when we work with parents in space, typically we only end up focusing on maybe like two accommodations or three accommodations, and the kid gets so much better because when you work on even just one accommodation, you're not just working on one. You're working on your child's ability to tolerate anxiety. And that is what's changing. And that's going to have an effect that is broader than just the one specific thing you're focused on. In the same way that if you have, weak muscles in your legs, there are tons of things that are going to be hard for you, right? Walking and running and hiking and stairs and jumping rope and biking, they're all going to be hard for you, but you don't need to strengthen your legs separately for each of them, right? You could pick any one of those things. And once your legs get stronger, all of those things are going to be easier for you. And I think a very similar process happens when you're working on the accommodation, which means you can give yourself a break from just, the headline of stopping all your accommodations, which is probably not going to work, and just pick one thing and work on it.
Yeah.
Give a direct example of an accommodation because you've used the term, but you've also given some really concrete examples in the past that paint a really strong picture. Could you do that?
Yeah, I would say I'll try to define it and then give like a few examples. So the definition is really broad. I think you're accommodating your child's anxiety or their distress in all of the ways that you change your behavior to try to help them not to have that distress, to try to help them to not have that anxiety. Sometimes you're trying to reduce anxiety in the moment. Sometimes you're trying to prevent it, right? Even preemptively to not create the situation where they might be. And all of the things you're doing differently, whether more of or less of, or just differently, those are the accommodations. So for example, you could take any anxiety symptom and you could see lots of ways that parents accommodate. In fact, lots of research and like all around the world shows that close to 100% of parents who have an anxious child do accommodate on a very regular basis, usually daily, even many times a day. So examples, your child has social anxiety and they're uncomfortable when someone speaks for them. And so you answer for them because you don't want them to be uncomfortable, or you don't want to be uncomfortable also when it's like this awkward silence. So you speak for them. Or maybe you avoid doing things like you don't invite company to the house because it would make them uncomfortable. Or your child has separation anxiety. They're scared to be away from you. So you don't go out in the evening. You don't leave them with a babysitter. Or maybe you sleep next to them at night because they're scared when they're alone. Or your child has OCD and they're really worried about contamination, and you start washing your hands excessively and showing them how you're washing really carefully, and you're buying them extra soap so that they can wash their hands more. And you do all of those things. They're all examples of accommodation. The number one most frequent accommodation, based on several studies, is just reassuring. It's just reassurance. Your child is anxious. And what does a child do when they're anxious? They come to the parent with their worry. And so you're reassuring them. It's okay. This isn't going to happen. I'm not going to get sick. You're going to do okay on your test. And you get into this cycle of just like endless accommodation. And the thing to know about accommodation is it's really well intentioned. It's a really natural, intuitive, and instinctive response. And also, it tends to maintain the anxiety and actually lead to it getting worse rather than better. As you accommodate more, kids tend to get more anxious, not less anxious, and the impairment in their life tends to get worse rather than better. And even treatment results for like you do cognitive behavioral therapy, or you give a child a medication. Even the results of those treatments tends to be worse when parents accommodate more. So I'm not saying that to blame any parent, because accommodating really is the most natural thing in the world. But the thing about anxiety disorders is that they're like hijackers. They
Right.
hijack the most natural thing in the world and then they make it run wild. And that happens with like accommodation. Sure, it's intuitive and natural, but then it gets hijacked by the anxiety disorder and becomes more of a problem.
Yeah, it's interesting, Ellie. I don't only focus on accommodation behaviors, but every kid and parents with whom I work, I have them pay attention to those things, and we don't pick all of them. In fact, I involve a kid if a kid is willing. And I'll say, hey, how hard would it be on your distress thermometer if your mom didn't do this? And usually it would be in a family group. And they'll say, well, maybe a 3 or 4, and we'll get numbers and we'll start with the easiest.
Mhm.
And the other thing sometimes I'll do, and kids love this, I'll ask kids to give their parents a grade. How's your mom doing on this? And they love it. And kids, I find that if I involve them and ask their opinions, they are much more willing and they come up with great plans, even with exposures. I mean, like, well, what do you think? They're like, well, I could do this. That'd be even better. I mean, that's what you want. You want them to, embrace it. But I agree, you can't stop all the accommodations at once. It's too hard. If a kid's used to it, they're going to be overwhelmed. And it helps to decide which one, so everyone knows.
I
Um,
love that. What is more fun than giving your parent a poor grade on their performance? That sounds awesome.
well, yeah, usually it's not that bad, but it's like a B minus, and I'm like, okay,
Oh,
well,
oh,
let's
wow. You
talk
don't know
to
my
them.
kids.
Yeah. Anyway, yeah.
So this will be our last question to the two of you before we're going to open it up. I'm also going to open up a comments panel. And so if people have questions, please write them in the chat and then I'll unmute you as we wrap up the last 10 minutes here. But so the final question from the ones asked on Luma was, how do we as parents tend to our own anxiety while holding space for students and families who have genuine reasons for concern?
Well, I may start. I mean, I think
Yeah.
it's not uncommon for parents of kids with anxiety problems to have their own anxiety problems. for a lot of reasons. There's genetic heritability, there's certain family dynamics, so that's not unusual. And it really varies. And there are times where it gets really extreme, and I've referred parents to do their own, CBT therapy because they recognize they just can't tolerate getting involved. But I think the biggest message that I have is if you really understand the science behind this, you're helping your kid. And and if you can hold on to that and be strong, then it's much more tolerable because it's hard anyway to deal with a kid who has major anxiety. So you might as well make it productive, right? And do something that is going to be helpful. And it can be done with love. So I think, anyway, that's my thought.
Yeah, I think that's great. And I mean, of course, I agree. If you need help for yourself, get help for yourself, right? Like it's okay for you to get therapy too, or work on your anxiety as well. I actually think that the process of helping your child to work on anxiety kind of is working on your own anxiety too. And it can be difficult. That on the one hand means it can actually be harder, but also it can yield real benefits because as you are working with them, as you're showing them anxiety is something that can be tolerated, as you're practicing tolerating some of their distress, you're working on your own ability to tolerate anxiety and to tolerate distress. And so I think like there is something really lovely about the process of helping your child and also seeing some gains for yourself. But at the same time, parents are under tremendous stress. And even if they don't have anxiety disorders, they tend to be really busy and juggling a lot and under a lot of stress. And this is just like another thing that's taking a toll on the family life. So try to build in some breaks for yourself. When is the time that I just need to take an hour for me to go for a walk in the park because I need to clear my head because otherwise I'm going to lose it. And sometimes you just need to do that. People love to say, like on the airplanes, put on your own mask before you put on your kids or somebody else's. And that's kind of true, right? Like people like to say it because it's true. You do need to be able to care for yourself a bit before, only just like sacrificing everything and putting all your energy. So it's okay to take a little bit of a break for yourself. By the way, it can be also nice to talk with your child about your own anxiety. That's not like weak vulnerability. They're going to respect you less or it's going to make their anxiety worse. No, I think they'll feel more understood and have it'll make it relatable. And also it models to them that this is something that we deal with in life. This is something that we talk about. And so I hope that you do get to tend to your own anxiety while you're also working with your child.
All right. I'm going to open it up. Let's see. It says that because of the number of people on the call that some of the chat has been disabled. So I'm actually going to take a chance here and unmute everyone, and then we'll see how this goes. So
maybe can you? There's the raise hand button
at the bottom in React. If anyone has the raise hand, but here I'll do it now, or anything you do down here. If you just want to do a thumbs up or raise hand, I'll be able to see that.
Maybe we answered everything.
It was the perfect call. No, I'm asking everyone to unmute, but we'll see if what happens. Oh, whose is this? Maybe. I don't know. I don't.
I do see someone waving her hand. Lisa, it looks like you're waving your hand.
Yep, I am. I have a question about. So I'm a counselor in a school, as I noticed some other of my colleagues on this call, and have done your space program. Eli and Dr. Walker are familiar with some of your work as well, and appreciate you both. So thank you so much for everything you're talking about. One of the things I hear a lot is parents who will talk about how their child's worry is really just about one thing, and then it pops up in other areas, and then it's just around math or it's just around something. And my understanding from the framework around the way worry tends to work is no doubt that child might have an actual learning difference with math, so it really is more pronounced in a particular area. But for a lot of kids, it seems like it's just kind of symptomatic or showing up in one area, but there's more areas where it can show up, and the parents kind of want to narrow it down to one thing and call it one thing. And I've heard you might be familiar with the clinician Lynn Lyons, who talks about how, yes, there are many diagnoses one can make around anxiety, but they're all under the umbrella anxiety. And a lot of times we complicate it by having too much language. And like, it's this, it's that, it's that. And then like kind of these discrete little things. It's reactive something, this, whatever it might be. And she's like, it's worry, it's anxiety. Yeah. So I'm curious about how you both would respond to that thought and how best to support families when they want to kind of just like have it be some like very narrow or concrete thing when maybe it's not as simple as that.
Well, maybe I'll start. I mean,
Sure.
I think again, back to the initial, educate yourselves. And the nature of anxiety problems is that they wax and wane. They come and they go and they change around. It's not unusual. And because these are internalizing issues, your kid's not going to always tell you, I'm afraid of, I don't want to go to this birthday party because they're going to serve pizza and I'm afraid to eat cheese or whatever. They're not going to, it's not going to be obvious. And so it's general principles, I think, of teaching your kid to tolerate anxiety, helping them to not avoid. Um, and I know what you mean. And in terms of, I see this quite often, especially when there's a fixation on trying to find diagnoses. And I mean, the principles are all kind of the same to me. The issue is, how do we help this kid with whatever they're dealing with? And things shift around. They really do. For one week it could be fear is, in neon lights. And then 2 weeks later, it's something else. And that's just the nature of these issues. So anyway, that's how I would respond to that, Lisa. Thanks for your question, though. It's a good one.
G. Moreno has asked a question in the chat. Would they like to unmute themselves and ask it themselves? If not, I will ask it. I requested everyone to unmute, so I don't know if they're there.
All right. Hi, here I am. Hi, I'm just wondering, the news is like pretty terrible. I don't know how much the kids are actually paying attention, but sometimes I'm a therapist and I sometimes do get some kids that are like, oh my God, I heard this. And then their brain goes, into all different sorts of imagining stuff as they're trying to understand what they heard. And I know we shouldn't be avoiding things, but with the news being so terrible these days, what is just your suggestions or thoughts about news and kids?
Yeah, there's lots of terrible news that that is true. And if you are prone to anxiety, then it's a little bit like you have an antenna on your head and it's just tuned to pick up things to worry about. And the news can definitely supply a lot of those. And then you can just you're lying in bed and churning away thinking about it, etc. What I would say is not that you should be trying to avoid the news per se, because I don't think you'll succeed anyway. If you avoid talking about the news, what that really means is that all the times your child does hear about the news, it's not from you. It is from sources that you don't control, that you don't determine how they're talking about it. And so I would say maybe do talk about it, but in an age-appropriate way. Maybe mediate it for them to some extent so that they're understanding it in a context rather than just like hearing something from a friend or social media or something like that, where it's not necessarily mediated. And I would also say, think about how you are talking, not just what are you saying, but how you are talking. If you talk about the news in a way that feel like you're so stressed and tense, then you are communicating to them, this is a really scary, frightening thing. Whereas if you can have a conversation, even about a difficult topic, then I think they can also then process that in a more sort of digestible way. Almost any news, maybe with some exceptions, but almost any news can be brokered or can be mediated for a child in a way that is appropriate to their development.
Mm-hmm.
And so it's don't leave it to everybody else to do it badly. Maybe do it yourself, but think about how you're doing it.
That makes sense. Thank you.
I agree. And we all have to accept that bad things happen. And it's important, I think, to teach your kids that, yeah, they do sometimes. And, we're okay and we're good. But I've heard parents say, well, I just want my kid to feel safe. And for them to never feel threatened. Well, that's not realistic because there's things that go on. We want a kid who is resilient and who can handle hearing these things and can learn that, yes, these things can happen, but usually not to them. So I think it's really important to have an attitude of acceptance about a lot of this stuff with and in an age appropriate way. Yeah.
Mhm. And I want to respect everyone's time. We are at the
Yeah.
1 hour mark. There is one more question though. So I just want to thank everyone for attending Ask the Experts. I want to thank
Thank
you,
you.
Dr. Bridget Walker. Thank you, Dr. Eli Lebowitz. And the last question will be from Taylor L. If people do need to drop off, please feel free, but I want to thank you all in advance. Taylor, I see you're unmuted. Please go ahead.
Thanks, Dr. Lebowitz, for saying uncomfortable when someone speaks for them. That really resonated with me, and it describes exactly our 9-year-old. So already a big step forward. Hearing you name that as a manifestation of anxiety gives me a big clue to do some more research myself. But just want to say thank you. But how else can I go pull on that thread and find out more about our child and how to help her?
Are you asking about like what are strategies for like getting more information, like for talking to the child? Or are you asking like what are some resources that I can access in order to learn more about this? I'm not sure if I'm.
So just very that symptom so closely matches our child makes me just feel really confident that there's something valuable here that I want to learn more about, right? Like before the talk today, I was like, yeah, she exhibits anxiety as a likely explanation for a lot of her
I see.
behaviors.
I
But I've
see.
also considered PDA. There's some other bundles of behavior that aren't always consistent with anxiety. But hearing you label it like that was like, oh, yes, that gives me confidence. This is the right direction to go learn more.
I see. Okay. So I'll say, first of all, thank you for the kind words, and I'm glad if it's been helpful. I do think, sometimes an assessment can be really helpful. It's true that like diagnoses are kind of tricky, but sometimes an assessment can actually be really helpful by having, even more than a call like this can give. Having somebody really sit down with her, with you, take some time and try to understand things may end up giving you the best understanding. In terms of learning more about the approach that I was describing, about how to approach some of those accommodations, maybe work on reducing them, I would point you to a couple of resources. One is a website for SPACE, the parent treatment that I developed. The website is spacetreatment.net. Maybe we can include it in some of like what we send out in the email, but it's spacetreatment.net. Although my teenage kids have told me that .net is the lamest domain name, so I'm very sorry for that, but it is spacetreatment.net. And the book that I wrote for parents is called Breaking Free of Child Anxiety and OCD. And that can be, I think that could be a really useful resource to both understand the topic a little bit more and then try to work on how you are responding to it. Of course, Dr. Walker's book I would also recommend in terms of strategies that you can suggest to do with the child or for your daughter to practice doing. So hopefully you'll get some help. It's it can be really useful to just work with a professional, I think, instead of trying to do it all alone.
One thing you might want to do, and we call it in CBT land, the downward arrow technique, and basically ask your daughter, honey, what would happen if you told the waiter, if I'm correctly understanding, if you told the waiter that you would like hot chocolate? What is she worried will happen? She might just say, I just don't want to do it. But she might also which might mean she just feels really uncomfortable, or she might feel embarrassed, but if you talk to her and ask her, well, I understand, but what's going to happen? Lots of kids will clam up and say, no, I don't know. I just want to do it. But if you persevere and you're like, well, yeah, I know, but what if you did it? Like, let's just pretend you did it. What would happen? So there's a lot of ways to talk to kids to sort of get at some of the underlying fears, which can shed light on what's going on diagnostically. And also the reason diagnoses are important is because they inform our treatment plans. But they're not, it's mostly the same stuff, but you've got to figure out for her what she's worried is going to happen.
I just want to say thank you for including me in this
Sure.
in this event, and to you, Bridget, and Markina for setting it up, and to everybody who was on here. Thanks so much. It's been my pleasure and honor.
Yes, thank you all, Dr. Walker and Dr. Lebowitz, and thank you all for attending.
Thank you all very, very much. And it's been really fun, Ellie, to do this with you.
It
And
has.
I think we both feel pretty passionate about what we do, and our approaches, they're different, but they're very complementary. And
For
it's
sure.
just been really, really enjoyable. And I hope everyone enjoyed it and got something out of it.
All right. Thank you.
Bye, everyone.